my name is Megan Loomis. We're recording the IV piggyback return demonstration video. In this video, we're going to be giving a medication called clafurin for an antibiotic, which is an antibiotic due to this patient having bronchial pneumonia. I'm going to wash my hands. We're going to always follow the 6 rights of medications. So, right patient, right medication, right route, right dose, right time, and right documentation. We're going to also follow our triple check. So every time we give a medication, we're going to check it 3 times before we give it. We're going to check our MAR and our order. So I've got our order. One thing that I noticed was, well, we don't have a date of birth, so we needed to make sure we updated that information, and we don't have a height, so we needed to get that information as well. The patient is allergic to penicillin, which this medication is generally contraindicated. So we would want to check with our provider before we gave this. We did it on our last video, so we are okay. And we collected our information and updated our MAR. So we've got a date of birth and we have a height for our patient. We checked, we looked up this medication. This medication is usually given about 2 grams for a serious infection. So we know we're not overdosing this patient. I would probably need more information to decide if this was a high enough dose for this medication. I would want to verify that order with the provider. We've got our materials here gathered. Our drop rate for our tubing is 10 drops per mil. So we calculated our drip rate at 67 mils per hour. If we're going to be infusing it 50 mils over 45 minutes, which equals 11 drops per minute. We also needed to calculate the amount of medication we're going to be putting into our 50 ml saline bottle. So on the back you'll see my math. So if we had a 500 milligram vial, or 500 milligram per ml vial, we would need about 1.1 mils going into our 50 ml IV. All right, so we're going to get things together. I think what I want to do first, I'm going to wash my hands. Wash my hands. We're going to get our medication out. We're going to look at our bottle. We've got 500 milligrams per mil of reconstituted clafurin. I wanted to check the time it was opened. It's open today, mixed today, so that's good. We're going to make sure there's nothing floating in there. We want to make sure that it's mixed properly. We don't want to shake it. This medication we want to keep out of direct light, and we don't want to overheat it, I believe. So we want to make sure that it was taken care of properly. Alright, so clean off our medication. That's fun. Alright, so we're going to drop the amount that we're going to give, so 1.1 mils. We're going to inject air into our vial. I'm going to turn it up the right way, and we're going to draw out our fluid, our medication. And then we would label this to make sure that we have the right amount before we go set up our IV tubing. So I would label this really quick with the medication, the amount, patient's information, and then I would keep this in my eyesight. Alright, we're going to clean up. And we get our tubing all ready to go. Actually, I'm going to wash my hands again. And then we're going to get our tubing ready to go. Make sure we close our clamp. Get this doodad out of our way. I would also want to, before I open this, I want to check the expiration date. I want to make sure there's no leaks anywhere, that it looks okay, there's no particles in there. I don't think I have my scissors on me either. Need help opening it. The struggle's real. So we're gonna there we go.
Yay.
Get our medication out. Alright. Actually, probably could have put my medicine in here before I even attached everything, huh? So I'm gonna get a different IV tubing set. Because I want to get my medication in here. We're gonna clean this off. Gloves. Hand hygiene gloves. See the medicine going in there. Okay. Alright, so then we'd have new set of tubing we'd open because we wouldn't want to use contaminated tubing, but we're just going to use this one, this material. We'd want to take this off. Switch hands. Get this in here. And we're still clamped up here. Alright. And then now that I've got this ready to go, I'd want to go into my patient room. So I'm going to take my gloves off, at least in one hand. I'm going to knock, go into my patient room. Hi Ivy, my name is Megan. I've got your antibiotic ready to go for you. Can you please check, verify your name and date of birth for me?
IV needed 1/2 of 1988.
Perfect. All right, I'm going to just check my MR one more time. So I've got 560 milligrams of chloroform. And we're going to infuse it over 45 minutes. And we've got 11 drops per minute. Okay, so we're going to go into our room. Before I administer the medication, I want to look at the IV site, make sure that it looks okay. We're going to perform hand hygiene again here, but I'm going to set everything up. So I want to look at that, make sure it looks okay. I'm going to get this set up so I can wash my hands. Okay. So I want to wash my hands. I want to look at the patient's IV site. Again, we want to make sure that there's no edema, no redness, nothing like that. We're going to want to get another alcohol swab. We're going to want to rub this in. And connect this. Okay. Alright, so we are currently infusing at the previous rates. Our antibiotic is still off. We're going to open up our antibiotic and we're going to adjust our rate off of the main line. So we're going to open this up. Oh, we need a, hang on a second. We need primer tubing. Disconnect this. fresh everything, so we're gonna clean everything off. Go in the garbage. Alright. So I'm going to open that up and then adjust. So this is going to be about 3 drops per 15 seconds. Should we not have any problems with anything? Alright, we're just about to add them there. Okay, so then I would count it over 1 minute to make sure I had the 11 drops per minute like we had originally planned. I want to double check my tubing again, make sure everything looks okay with the patient, make sure the patient is comfortable and sitting at a comfortable level, that they have their call light, and any questions are answered. Before I would give the medication, I would make sure that the patient knew what this medication is for. It's for their pneumonia. And verify any allergies with them, and answer any questions that they might have. And make sure that they know to let me know if they have any concerns as they're receiving this medication. You know, if they start to get itchy or something like that, to hit their call light, let me know right away. I would perform hand hygiene before I leave the room. And then I would want to document my medication, the rate that I've got it flowing at, that it's IV piggyback, which arm it's going into, and the time that I'm giving it. So I mark that in here. Alright. Let's see, this 12. So we go right here, and then we go, let's see. Let's see, it's her right arm. Let's see, 200. Okay.